Hello, this is Dr. Gay from First Look MRI, and this is a 63-year-old female who feels something palpable along the posterior medial ankle. This is an axial view where we can see the tibia and fibula. You can see the slice right here. This is the corresponding sagittal image. We see the tibia coming down. This is the front of the foot. Here's the bottom of the foot, the plantar aspect. This is the heel area back here. This is the Achilles tendon to get oriented here. So in this view, as we come down, we see where they're feeling the palpable abnormality. It's on the medial side. If we look deep to that, we see we have three tendons, 1, 2, 3 tendons here. These dark areas are tendons. This is the posterior tibial. This is the flexor hallucis. And this is the flexor digitorum tendons, 1, 2, 3. But this patient has another one over here. Again, 1, 2, 3. But there's another one behind the flexor digitorum. This is a muscle of the flexor digitorum, the muscle belly. This is the central tendon. And there's a separate thing behind there. You can see the tendon is very small. These two tendons almost touch each other there. And this is an accessory tendon. It's in about 2 to 8% of people. And it's called the flexor digitorum accessorius longus muscle and tendon. And it's behind this. These are the neurovascular structures within the tarsal tunnel. And it's behind here the flexor digitorum. So this is the classic location we see on the axial images here. And this is what they're probably feeling. This is the palpable abnormality, this soft tissue fullness over here. This is subcutaneous fat. Sometimes you can have asymmetric amounts of subcutaneous fat, but I don't see any lipoma or anything that asymmetric. So since the marker is really right over this accessory muscle, this is probably what it is. Sometimes when people exercise or walk, this can swell up and become enlarged and be more palpable. But an anatomic variant that's not that uncommon. On the sagittal view here, we see it right here. This dark line here in the front is the flexor digitorum. Here's the muscle, and the black line is the tendon. And then behind it here, this is that accessory muscle. And it comes down, loops around like this underneath. So the flexor digitorum accessorius longus muscle, which is not terribly uncommon. It's in the posterior medial aspect of the ankle, and sometimes it can cause the sensation of a palpable abnormality, especially when it swells up with exercise. And that's it. Thank you very much.